Welcome. Let's get to know Voxzogo.
Voxzogo, vosoritide, is a once-daily treatment for increasing linear growth in children with achondroplasia whose growth plates are still open. Voxzogo may cause serious side effects, including a temporary decrease in blood pressure in some patients. To reduce the risk of a decrease in blood pressure and associated symptoms, dizziness, feeling tired, or nausea, patients should eat a meal and drink 8 to 10 ounces of fluid within 1 hour before receiving Voxzogo. Please see important safety information at the end of this video.
Achondroplasia affects endochondral bone growth, a process that replaces cartilage with bone tissue as bones grow. Endochondral bone growth occurs at the growth plate, found at the end of most bones in the body. Two important signaling pathways for bone growth are FGFR3 and CNP. FGFR3 slows bone growth, while CNP promotes bone growth. While bones are growing, these two signals perform a careful balancing act. In achondroplasia, a change in the FGFR3 gene causes it to send more signals to slow bone growth than it should. The body's CNP is not enough to balance the overactive FGFR3 signaling, tilting the balance and slowing down bone growth. This imbalance of FGFR3 and CNP signaling pathways leads to impaired bone growth throughout the body. Achondroplasia slows down endochondral bone growth, which takes place in over 90% of bones in the body. Voxzogo is a molecule that works alongside the body's natural CNP to stimulate the CNP signaling pathway. Voxzogo bolsters CNP signaling to improve the balance with overactive FGFR3 signaling. By increasing CNP signaling, Voxzogo increases the rate of bone growth in children with achondroplasia who have open growth plates. It's go time. Talk to your doctor to learn more about Voxzogo. Want more information? Visit voxzogo.com.
Important safety information. What is Voxzogo used for? Voxzogo is a prescription medicine used to increase linear growth in children with achondroplasia and open growth plates, epiphyses. Voxzogo is approved under accelerated approval based on an improvement in annualized growth velocity. Continued approval may be contingent upon verification and description of clinical benefit in confirmatory trials. What is the most important safety information about Voxzogo? Voxzogo may cause serious side effects, including a temporary decrease in blood pressure in some patients. To reduce the risk of a decrease in blood pressure and associated symptoms, dizziness, feeling tired, or nausea, patients should eat a meal and drink 8 to 10 ounces of fluid within 1 hour before receiving Voxzogo. What are the most common side effects of Voxzogo? The most common side effects of Voxzogo include injection site reactions, including redness, itching, swelling, bruising, rash, hives, and injection site pain. High levels of blood alkaline phosphatase shown in blood tests, vomiting, joint pain, decreased blood pressure, and stomachache. These are not all the possible side effects of Voxzogo. Ask your healthcare provider for medical advice about side effects and about any side effects that bother the patient or that do not go away. How is Voxzogo taken? Voxzogo is taken daily as an injection given under the skin, administered by a caregiver after a healthcare provider determines the caregiver is able to administer Voxzogo. Do not try to inject Voxzogo until you have been shown the right way by your healthcare provider. Voxzogo is supplied with instructions for use that describe the steps for preparing, injecting, and disposing Voxzogo. Caregivers should review the instructions for use for guidance, and anytime they receive a refill of Voxzogo in case any changes have been made. Inject Voxzogo 1 time every day at about the same time each day. If a dose of Voxzogo is missed, it can be given within 12 hours from the missed dose. After 12 hours, skip the missed dose and administer the next daily dose as usual. The dose of Voxzogo is based on body weight. Your healthcare provider will adjust the dose based on changes in weight following regular checkups. Your healthcare provider will monitor the patient's growth and tell you when to stop taking Voxzogo if they determine the patient is no longer able to grow. Stop administering Voxzogo if instructed by your healthcare provider. What should you tell the doctor before or during taking Voxzogo? Tell your doctor about all of the patient's medical conditions, including If the patient has heart disease, cardiac or vascular disease, or if the patient is on blood pressure medicine, antihypertensive medicine, if the patient has kidney problems or renal impairment, if the patient is pregnant or plans to become pregnant. It is not known if Voxzogo will harm the unborn baby. If the patient is breastfeeding or plans to breastfeed, it is not known if Voxzogo passes into breast milk. Tell your doctor about all of the medicines the patient takes, including prescription and over-the-counter medicines, vitamins, and herbal supplements. You may report side effects to BioMarin at 1-866-906-6100. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/MedWatch or call 1-800-FDA-1088. Please see additional safety information in the full prescribing information and patient information at voxzogo.com.